Good day everyone, I'm Olami Martinez and I'm here today to share the important health topic that affects people of all ages, the gastroenteritis, more commonly known as the stomach flu. In this presentation, I'll give you a quick guide to its symptoms, causes, treatment, and prevention. Gastroenteritis is very common, especially among children, and while it usually goes away on its own, it can be serious if not properly managed. By the end of this presentation, I hope you'll feel more confident in recognizing the signs, knowing what to do, and most importantly, how to protect yourself and others from getting sick. Let's begin. So, gastroenteritis, also known as stomach flu, happens when the lining of the stomach and intestines becomes inflamed. This inflammation is usually caused by germs such as virus, bacteria, and parasites. These germs enter the body mainly through contaminated food, dirty water, or contact with infected people or surfaces. The condition is very common, especially among children and adults who live in places where sanitation is poor, meaning there may not be proper waste disposal, clean drinking water, or good hygiene practices. In these environments, it's easier for germs to spread from person to person or through food and water. Though gastroenteritis is often mild and lasts only a few days, it can be dangerous if it leads to dehydration, especially in young children, older adults, or people with weak immune system. A quick guide to symptoms, treatment, and prevention means a simple and easy to understand overview of the most important thing you need to know about an illness like gastroenteritis. Symptoms tell you what to watch out for, such as diarrhea, vomiting, stomach pain, and fever. Recognizing symptoms early helps in managing the illness quickly. Treatment explains how to take care of yourself or others if infected. This includes rest, drinking plenty of fluids, using oral rehydration salts or oars, and knowing when to seek medical help. Prevention gives you tips to avoid getting or spreading the illness. This includes hand washing, eating safe food, drinking clean water, and cleaning surfaces and getting vaccinated. In short, this guide helps you understand, manage, and prevent the illness in a simple and practical way. Viruses are the most common cause of gastroenteritis, especially in young children. Two main viruses responsible are rotavirus, a leading cause of severe diarrhea in infants and toddlers, often spread in daycare center or through unwashed hands. Next is norovirus, which is also known for causing outbreaks in places like schools, cruise ships, and nursing homes. It spreads very easily through contaminated food, water, or surfaces. Aside from viruses, bacteria can also cause gastroenteritis. This usually happens when people consume unsafe or contaminated food and water. Common bacteria include Escherichia coli, found in undercooked meat or unwashed vegetables. Next is Salmonella, which is often from raw eggs, poultry, or unpasteurized milk. Next is Shigella, which spreads through contaminated water or close contact with infected people. These bacterial infections can cause more severe symptoms, sometimes including bloody diarrhea and high fever. The main symptoms of gastroenteritis includes diarrhea, which is often watery and frequent. Next is vomiting, which may come suddenly and can last for a day or more. Next is stomach cramps or pain, which is caused by the inflammation in the digestive tract. Next is fever, which is sometimes mild but it can be higher in bacterial infections. Last but not the least is weakness or fatigue, which is due to loss of fluids and nutrients. One of the most serious concerns, especially in young children, is dehydration. This happens when the body loses too much fluid from diarrhea and vomiting and isn't able to replace it fast enough. Warning signs of dehydration in children include dry mouth and tongue, no tears when crying, sunken eyes or soft spot on the head or fontanelle, unusual drowsiness or irritability, little or no urine output, or fewer wet diapers. And if these signs appears, it's important to give oral rehydration fluids right away and seek medical help, especially if the child can keep fluids down. Most cases of gastroenteritis are mild and self-limiting, meaning they go away and on their own within a few days. The main treatment is to rest and allow the body to recover, drink plenty of fluids to replace what's lost through vomiting and diarrhea. To prevent or treat dehydration, especially in children and older adults, It is important to use oral rehydration salts or ORS. ORS is a special solution that contains the right balance of water, sugar, and electrolytes, like sodium and potassium, to help the body absorb fluid better. Antibiotics are not usually needed since most cases are caused by viruses, which don't respond to antibiotics. However, doctors may prescribe antibiotics if the infection is caused by certain bacteria like Shigella or severe Salmonella. The patient is very young, elderly, or has a weak immune system. The symptoms are severe or prolonged. You should seek medical attention immediately if the person has signs of severe dehydration, like very dry mouth, no urination, and extreme weakness. Next is high fever, especially above 39 degrees Celsius or 102 degrees Fahrenheit. Next is bloody stools, vomiting that won't stop, symptoms lasting more than 3 days. Prompt treatment can prevent complications, especially in young children. Prevention is the best way to avoid getting or spreading a gastroenteritis. Here are the key steps. Number 1. Wash hands regularly. Hand washing with soap and water is one of the most effective ways to prevent infection. Always wash hands before eating, after using the toilet, after changing diapers, and after caring for someone who is sick. Number 2. Ensure food and water are safe. Drink only clean, treated, or boiled water. Make sure food is well cooked, especially meat, poultry, and eggs. Wash fruits and vegetables thoroughly. Avoid eating food from questionable or unsanitary sources. Number 3. Vaccinate children against rotavirus. The rotavirus vaccine is recommended for infants and can significantly reduce the risk of severe diarrhea and hospitalization. It is part of the routine childhood immunization schedule in many countries. Number 4. Clean and disinfect surfaces. Regularly clean commonly touched surfaces like doorknobs, tables, bathroom fixtures, using disinfectants, especially during an outbreak. This helps stop the spread of viruses like norovirus, which can survive on surfaces for days. Number 5 is to avoid sharing personal items during outbreaks. Do not share utensils, cups, or towels with others if someone is sick. If someone at home is infected, limit their contact with others and sanitize any items they use. Stay clean, stay safe, and protect your gut means practicing good hygiene and healthy habits to prevent infections like gastroenteritis, which can harm your digestive system. Stay clean, wash your hands regularly, keep food and kitchen areas sanitary, and bath or shower daily to remove germs. Stay safe, make sure food and water are safe to consume. Avoid eating spoiled or undercooked food and be cautious in areas with poor sanitation. Protect your gut. Take care of your digestive health by avoiding infections, staying hydrated, and getting vaccinated when needed, especially children against rotavirus.
Good day everyone, I am Ginny Kate R. Makabasag. So today I will be going to tackle what is diarrhea, the common causes of diarrhea, the symptoms, treatment, and prevention of diarrhea. So what is diarrhea? The experience of diarrhea varies greatly. Some individuals might experience only mild discomfort, such as slight stomach cramps and increased bowel movements. Others may suffer from severe cramping and become dehydrated due to fluid loss. Severe dehydration is dangerous, so drinking plenty of fluid is essential if you have diarrhea. In short, most cases of diarrhea are harmless and temporary. But if your diarrhea lasts a long time or you feel very unwell, it's vital to consult a doctor for diagnosis and treatment. So what is the common causes of diarrhea? It's often caused by a bug, like bacterial or parasitic from contaminated food or water, but also by certain meds, food, sensitivities, or underlying condition like IBD or IBS. So these are the symptoms of diarrhea. Includes abdominal cramps and pain, bloating and gas, nausea and vomiting, fever, blood or mucus in the stool, urgent need to have a bowel movement, dehydration like dry mouth, thirst, decreased urination, and dizziness. Here's some treatments of diarrhea that you can feel better quickly. Hydration is key. Guzzle water, broth, or electrolyte drinks. Eat bland foods like bananas, rice, applesauce, and toast to suit your stomach. Over-the-counter meds might help, but if you're really suffering or it's dragging on, see a doctor immediately. This is the prevention of diarrhea. Stop diarrhea before it starts. Don't let diarrhea ruin your day. Simple steps can make a huge difference. First, wash your hands. This is your first line of defense. Second, handle food carefully. Cook it thoroughly and store it properly. And third, when traveling on drink bottle or purified water. And yes, there are even vaccines that can protect you from certain types of diarrhea. Take charge of your gut health. So that's all. Thank you.
Good day everyone, my name is Alden Matthew F. Makapalag. Today I'll be going to tackle the Hirschsprung disease. So next, what is Hirschsprung disease? Hirschsprung disease is a birth defect where nerve cells like ganglion cells are missing in part of the baby colon, like large intestine. These nerve cells are important because they help the bowel muscle move stool through the intestine, like peristalsis. Without them, the affected part of the colon cannot push stool forward, causing blockage or constipation. The next is the causes of the Hirschsprung disease. The exact cause is unknown, but it's related to a problem in embryonic development, where the nerve cells fail to form in the lower part of the colon. It can be genetic and it's sometimes associated with conditions like Down syndrome. The next is the signs and symptoms of the Hirschsprung disease. In newborn, first, failure to pass the meconium within 24 to 48 hours. Meconium is the baby's first stool. Most baby pass it within the first day or two. If not, it could mean there is a blockage in the intestine. The second is the poor feeding. The baby may have little interest in feeding or may have spit up often due to discomfort or fullness. Third is vomiting. When the bowel is blocked, food and fluids can move through, leading to vomiting. Green vomit or with bile is a serious sign of bowel obstruction. And the last is swollen abdomen. The baby's stomach looks big or feels firm because gas and stools are building up inside. The next is signs and symptoms in older children. First is chronic constipation. The child may have difficulty pooping, go only a few times a week, or need help like laxative or enemas regularly. The second is abdominal bloating. The belly may look round, firm, or swollen because of stool and gas buildup. Next is poor weight gain. The child may not gain weight properly due to poor digestion and appetite. And the last is delayed growth. Long-term feeding problems and constipation can affect the child's overall growth and development. The next is diagnosis of the Hirschsprung disease. First is rectal biopsy. A small sample of tissue is taken from the rectum or end of the colon. It is checked under the microscope to see if the ganglion cells or nerve cells are missing. If the nerve cells are absent, it confirms Hirschsprung disease. The next is barium enema X-ray. A liquid called barium is placed into the rectum and an X-ray is taken. The barium outlines the shape of the colon. Doctors look for a narrow section or ganglionic and a swollen part of dilated just before it. The third is anorectal manometry. A small balloon is placed in the rectum. The test checks if the muscle of the rectum relaxed properly. In Hirschsprung disease, the muscles do not relax, which is abnormal. The next is treatment of the Hirschsprung disease. The main treatment is surgery to remove the part of the colon without nerves or a ganglionic segment. This procedure is called a pull-through surgery, where the healthy part of the colon is connected to the anus. The next is prognosis of the Hirschsprung disease. With early diagnosis and treatment, most children can live a normal life. However, some may continue to have issues like constipation or infection, or enterocolitis after surgery.
Kapulay, and I'm going to talk about colic in infants. So what's colic? It's a common condition that can be very stressful for both babies and parents. So let's understand what it is, why it happens, and how we can help manage it. So colic is when a healthy baby cries frequently for a long time and without a clear reason. It usually starts when the baby is about 2 weeks old and may last until around 3 to 4 months. The baby may cry for more than 3 hours a day, at least 3 days a week for 3 weeks or more. Even though it can be very upsetting, colic is not dangerous and it usually goes away on its own. The exact cause of colic is still unknown, but here are some possible reasons. An immature digestive system, a gas or trapped air in the tummy, overfeeding or underfeeding, sensitivity to milk or formula, or even emotional stress or overstimulation. It's important to remember that colic is not caused by a bad parenting. How do we know if a baby has a colic? We can look for the signs of long, intense crying that often in the evening, a high-pitched piercing cry, red face and clenched fist, then the baby may arc their back or pull their knees to chest, passing a lot of gas or when they're having difficulty sleeping or feeding. These symptoms can be very tiring for both baby and caregiver. Now, how do we help a baby with a colic? Let's look at a few simple tips. In feeding techniques, we need to burp the baby often to remove the gas. Then try a smaller, more frequent feedings and make sure that the baby latches properly or the bottom nipple is not too fast. In soothing techniques, gently rock the baby or use a baby carrier. And then use a calming sounds like a lullaby or white noise, and try a warm bath or gentle tummy massage. In managing sleep, keep a regular bedtime routine, create a quiet, comfortable space for sleep, and swaddling can help some babies feel secure. Sometimes, a change in the mother's diet, if breastfeeding, or switching formula may help, but always consult your pediatrician first. Always remember that colic is temporary. It can be exhausting, but with patience and care, your baby will get through it. If the crying seems too much or something feels wrong, don't hesitate to ask help from your doctor.